Milaap is delighted to invite you to the launch of our book, Making Healthcare Accessible in Bangalore.
Privilege to welcome our Honourable Minister for Health and Family Welfare, Shri Dinesh ji, for his invaluable presence today. Bangalore's healthcare system is known for its advanced hospitals, cutting-edge research institutions, and a strong patient-centric model.
A caregiver's handbook by the chief guest Shri Dinesh Gundu, Honourable Minister of Health and Family Welfare, Government of Karnataka. Also join us for a panel discussion held by panelists Dr.Sonal, asthana, liver transplant surgeon, Anoj Viswanathan, co-founder Milaap, Valli Narasimha Samiksha Foundation, Dr.Shalini Nalwad ICATT Ambulance Services, and Rizwan Ahmed Gubbachi Learning Community on navigating healthcare away from home.
Congratulate Milaap for having managed this book, the handbook, which can be of great assistance to people, where they can get various information regarding health facilities and all the other allied information needed, whether it is the hospitals or pharmacies or ambulances or places of stay close to the hospital. So it's a very good initiative, and I want to congratulate Milaap for this work they've done. And of course, I was currently known up before. She's been doing a lot of good work in the social sector, healthcare sector, and the running ambulance services, and also in the field of CPR, doing programs with the police department and other departments, training people on emergency care. So she's very much involved in various activities which concern the health of the people and how we can improve health services, and how people individually can also prepare themselves and acquaint themselves with the best practices in the health sector. So Dr. Shalini also is here, and she asked me to come over here for this program, and because she invited me, that's one of the reasons why I came, because I know that she's been doing a lot of good work. So for this, I won't take too much time. But Milaap, I think what they said just now, that they are doing a lot of work for helping people. We all know cost of healthcare, especially tertiary healthcare, has gone tremendously, and also there are a lot of cutting edge technologies that are being used in the medical field, and those procedures and treatments are very high and can become very expensive. And many people, because it's also a question of a person's life or a person's well-being, and people always will want to get and give the best available treatment to their beloved ones. They will be poor or middle class or rich, but they always go beyond what they can afford, because this is the health, because it's a question of health. So many people go into a lot of crises, financial crises, because of that. And so I think for Milaap to come forward and bridge that gap using a lot of CSR funds and other charitable and from various other foundations and helping people, I think that's a wonderful job, and very glad to know that they have done for the last more than 10 years they've been doing this work, and I commend them on this, and let them continue to do more of this. And being the health minister here, of course, government sector is a huge sector, and we cater to more of the poorer section and lower middle class people and all that. And our institutions, we have built many good institutions also. With tertiary care, if we talk about healthcare, in heart care, we have Tigwai, we have Jayadeva for heart, Tigwai for cancer, for rare diseases, for children, we have the Indira Gandhi Institute. For trauma and care, we have the Sanjay Gandhi Institute. So many hospitals In fact, many super specialty hospitals have also been built by us. And we are trying to cater and trying to get high-end treatment or high-quality treatment for the poorest of the poor at very, very basic minimum prices. So we are doing our best, and in the future also, when we think that we can collaborate, Milaap and Dr. Shalini, definitely we are always willing to do that, and feel that our people benefit, and so that they can lead more healthy and a more fulfilling life. Thank you very much, and I wish you all the very best.
The book is a small initiative to give them the right resources and information that allow financial assistance to carry out their tertiary care treatments like cancer treatments or organ transplants and so forth. We've been in Bangalore, we launched it in 2010. Treatment to treatment, so to speak. And there are also sort of, so short answer, planning is very hard, especially when it comes to tertiary care, right? Especially chronic, critical, complex treatments, like for example, cancer care, organ transplants, etc. You never know what could essentially sort of turn out. The past is not necessarily an indicator. Of course, 5 year, there are studies around 5 year success rates, 5 year, no remission and all of those, right? So one of the first things to sort of think about is understanding the options, trying to understand, as one of the things that I've realized is most of us, when it comes to the good things in life, we do a lot of permutation combinations, which is essentially, okay, if you want to buy a house, you would do a lot of analysis, paralysis, okay, this is what this would cost, that would what cost, this is your width, interior furnishing, etc., and all this. But when it comes to emergencies, especially health, and I'm not talking about any strata of society, I'm talking about like across strata, right? You do not want to think beyond what is just presented to you, right? Simply because you feel like, oh, if I were to think about it, I might actually manifest it. And this is true story. A lot of reasons why people don't buy health insurance, right? Cultural wise, is the reason that, hey, I've been good so far for 50 years of my life without a health insurance. What if I buy? I'm actually manifesting something. Sounds ridiculous, but I have 2 people in my home, my in-laws, who think that, right? So, and I run this platform for the last 15 years, and they have not been convinced, right? So much that I brought them compulsorily under our own company insurance. But coming back, what is more important essentially is awareness around what could essentially happen, right? And I think in general, hospitals in India do a great job in setting the expectations, because you will never see hospitals saying that, oh, this will only cost this much, right? You will never hear, I mean, especially the serious ones, the tertiary care ones, they always set the expectations that this is the outer possibility, right? And more often than not, it is lesser. But having that mindset to accept, and that would only come when you are in a place where you can make rational decisions, so you have an ecosystem to sort of support it. Number 2, coming back to the challenges, so to speak, like I said, having a good safety net mechanism, having an insurance that covers for it is the first one. Having a good savings mechanism is another important one. And the third one is, I think, as a culture, it has been inbuilt. I think the society and our family, most of the treatments, like we've seen in tertiary care, literally, in India, literally, I think around $4 billion of healthcare is financed by friends and family, right? So there's government, there's insurance, and the third number is friends and family, right? And then comes your loans and so on and so forth. So I think that's a beautiful sort of a thing, which you wouldn't probably see, so prevalent in, the other societies, so to say. But I think it all boils down to one thing, which is essentially to say, having a clarity in terms of this is what it would happen and this is what it is, right from the time of diagnosis, right? Of course, I could say even before, but like I said, nobody wakes up in the morning thinking what if of the worst scenario. But let's say even when you are handed out the bad news, right? Being in that position to sort of accept and basically say, what would this entail, right? And across economic strata, across society, I think that is one place where culturally we have to become more sensitized to that it is okay, right? And I think that's probably the first piece, the mindset, and then once you figure that out, once you have a perspective, then the options start playing out. Whether you can fund it through your savings, whether there is an option for you to sort of mortgage, friends and family, and probably last resort, use mechanisms like crowdfunding, etc. But for you to actually come there, it's important to have that sort of accepting mindset. I think that's the bigger thing than I would say financial challenge as such. So, thank you.
Thank you so much. Organ transplant, receive organ transplant, they die before they get the organ. So, and it doesn't spare rich or poor. Everyone comes under a very transparent waiting list from National Registry and Legal Registries. So this young man, where family thought he has last few days left to live. God's grace and thanks to Sonal's skills and this leadership in Karnataka in terms of leading this liver transplant and giving many lives back. So he got a liver transplant. And from Mohan Foundation, we can tell us the figures, nearly 90% donors who he had a liver transplant done. He's been waiting for a while and then he was at the end-stage liver disease and family almost lost hope that he's going to go away. And he was in his mid-50s with a young son and of course parents distraught. Thank you so much Anuj and Sandy and all of you for having me here. And then Milaap and ICATT Foundation and ICATT Air Ambulance has been we have been working together for a long time, especially during COVID and after COVID as well. We have done a lot of COVID-related work in terms of providing under a campaign called COVID India campaign with me and Sudeep Larisetti. We both kind of headed a campaign where Milaap played a great role, bridging the gap between the donors and the ICATT Foundation COVID India campaign. I can speak about the campaign for almost 3-4 hours, but one of the most important one was SOS, that is Save Us Saviors, where we provided N95 and masks. So I just wanted to highlight the work we have done together as well when we're all here. And along with that, we adopted 10 ICUs across Karnataka. We trained the doctors and ICU staff how to manage patients. Along with that, we also ran Breathe India, where we used to convert every 48 hours, we used to convert one oxygen isolation center into oxygen center with training and medications. So, and now Milaap has been involved with few of our patient airlifts as well. So coming to the point about delivering bad news, I would say straight on to that, the training is what plays a major role here. So when we are training in the UK, although we are anesthetists, where we hardly ever speak to the patients, just we speak to them before anesthetizing them when we do a pre-op check, but after that, we hardly ever get to speak once we get a patient, wake them up, send them to the ward. Having said that, we also do a lot of critical care and we come across these miserable diagnoses where we have to break this bad news to the families and patients and friends sometimes. There is a special training for that, entire exam module of ours is a communication skill. We can be the most the brilliant student getting full marks in our clinical examination in our theory, but they fail us if we don't do our communication skill well. This is the important that is given in a fellowship examination, that is one of the toughest examination in the world, they say UK fellowship exams, where communication by itself is a huge part of our exam. So you can imagine the training we have to go through to be a good communicator. And the way we sit down, the way we make the eye contact, the way we get some tea for the family, pull the screen across, maintain privacy, and then take it, because that is the moment where the entire world is going to turn upside down. And from then on, until they reach a certain stage of getting a transplant done or a therapy or something, their life is going to be like tumultuous. Like you can imagine if you get a fever, you can't go out for 1 weekend, if you can't get out, or you miss few meetings, you feel so bad as if the entire world has come to a standstill. But here, people go through this for years together. So the families have to hold on to that. But an initial diagnosis is such an important thing in communicating that. I think we have to inculcate that culture of communication in India. I've seen some of my relatives and friends who got bad news about their cancer diagnosis, or one of their child being kidney failed or liver's gone, congenital heart disease, being so badly communicated. I don't blame on the anyone, but I think it's the training. At the end of the day, it's the training. Training makes a lot of difference.
All this time. This had to be done. These were some of the parameters or indicators which had shown us whether it's going fine or you need to do something. So there is a gap. With this so strong that they somehow it gets diluted. They get back to their normal life and think everything is fine. And so, first of all, see, through this long-term treatments or whatever, they're financially drained, completely gone back, like, even a good family, like what statistics showed, like they went back to poverty and they had to sell their assets and so on. So with these things in the back of the mind, going back and rebuilding everything takes more priority for them. So there is a slip down there. Then what happens is, like, yeah, in India, at least now we have tier 1, tier 2, other cities where we are able, but rural, still we don't have. They have to get some tests done on regular basis to see that and share. But at least we have, thanks, we have a WhatsApp and whatever. I know doctor might be so, everybody sending messages, reports, and that might be like, so still there is that gap is there. And so in all this, that somehow the understanding of follow is and getting those routine things done is still not gone through well inside their system. So I think we should work on that, and we have seen many misses through that.
On a phone call. So I just have to say this. So there was this child who was from an Urdu medium school, and he had to learn trigonometry. He did not know what theta was, how to draw theta, because it is learned by rote. So my volunteer tried her best to explain, and finally she was so frustrated. She said, "I've never done that." So then he understood, okay, this is, you have a ellipse, eclipse, and then you have the line. So that was how he understood what, theta was. I had one kid who wanted to do an entire third language Hindi syllabus in 15 days. What his teachers did not do through the year, he wanted the volunteer to help so that he could pass his exam. So these are kind of systems that we have in place where the child is still handheld even after they finish treatment and they go back to life. We provide them, we have a digital learning app which every child is given access to it free of cost. We have volunteers from big corporate companies who, as part of CSR, give their time to the child once a week and make sure that the child is learning. They are always available when the child is hitting a roadblock in terms of their academics or when they have any doubts. We have volunteers who help and work with these kids when they are going through their board exams. Including we have volunteers who help even degree level students. So children who have finished treatment, we also have a very robust scholarship program that we provide. And it's a matter of pride for us that we have given out 440 scholarships worth 65 lakhs over the last 5 years. And these are for children who have fought the disease, who are warriors, who are survivors, and who have gone back to education. We have had children who are pursuing their engineering, pursuing their BCAs, right from 8th grade upwards to undergrad. This year, in fact, we have a student who has cleared her NEET and wants to study, and she has reached out to us for a scholarship. So, in that sense, we try to provide as much of support outside the hospital environment once the child goes back to their regular, normal environment over and above this. And we make sure that whenever the child comes back for doing maintenance, he or she can come back to the learning center, interact with the teachers, make sure that the day is not wasted when they are back in the hospital, and continue with their education or academics. And then we have had the same children who come back as volunteers for the children who are undergoing treatment. So that's the beauty of the system.